Welcome to episode 1 of the Living Gratefully Well podcast with Dr. Julius Torelli. Dr. Torelli is a medical doctor, a cardiologist with many years of experience, who has more recently become very invested in the world of holistic wellness. And this podcast series is going to be all about him sharing his wisdom about that. Julius, why don't you give us a little bit of an explanation of exactly what Gratefully Well is and what your mission is with this brand?
As I was in practice, one of the things that I noticed over time, was our what I would call almost complete attention to the physical issues that people have, as opposed to, leaving out what I call the non-physical dimensions of health, such as mental health, behavioral, emotional health, social health, cultural, things like that. We just didn't pay attention to that. In addition, a lot of the people who go to see doctors, in fact, I would say most of the people, we never find anything physical causing their issues, right? Things like the poster childs, I think, for that are sort of migraine headaches and irritable bowel syndrome, right? People can be very disabled, very debilitated by those conditions, but we never find anything. And so my practice kind of evolved from the traditional kind of physically based practice to start to incorporate this, I call it more holistic kind of view, really this view trying to incorporate these other dimensions of health. So it's a new paradigm to a degree. In addition, though, it doesn't throw out the baby with the bathwater. It's not to say that everything in Western medicine is wrong or bad. Sometimes physicians, especially who get into alternative medicine or functional medicine, will sort of talk poorly about some of the things in Western medicine, like pharmaceuticals. This is something that can be done, it can be added on to your standard treatment. So if you need surgery, this can sort of be added on. If you have cancer and you need chemotherapy, this approach can be added on to that as well. So when I was first writing that mission out, I concentrated a lot on this new paradigm of healthcare. And it basically was, to transform healthcare by integrating these non-physical dimensions of health. I've changed that a little bit to focus on the person as well. So one of the things that I have found is, and this is especially true for Americans. A lot of Americans are just passive in their own healthcare. In other words, they've been, part of it is just culturally what we've done. We've always put the responsibility of healthcare on the physician, right? So in other words, if you wake up in the morning, you have a headache and you take some aspirin or Tylenol, it doesn't go away, and you go in to see the physician because you expect him to do two things, right? You expect him to figure out what's going on, and then you expect him to fix it. And then you leave there with a prescription generally, right? Because most headaches are not due to, brain tumors and things like that. And so in this model, the first thing is there has to be a willingness to take personal responsibility, at least to some degree, for your own healthcare. And so I changed the mission to really incorporate that. That's actually the first part, sort of to empower people who are willing to take an active role in their healing or in their healthcare by integrating these non-physical dimensions of health into what I like to think of as a new paradigm for healthcare. So that's it in a nutshell, if that makes any sense.
It does. And I think to enunciate one of the things that you just said is the idea that like how someone thinks about themselves and how they behave on a day-to-day basis can have such a massive impact on their overall well-being, including chronic health conditions, whether it's a physical or a condition that has a very physical manifestation like irritable bowel syndrome, or something more like depression or anxiety where it's mostly inside their head. I think a lot of people just fundamentally don't understand that they actually do have the power to correct or improve upon a lot of those things without necessarily needing a pharmaceutical or in addition to. And I think I've seen I've seen a number of mental health workers in my life, uh, and the best one that I ever worked with used to say that when you're thinking about improving when it comes to something like depression or anxiety or probably a lot of other chronic health conditions, you basically have three uh, tools that you can work with, and or three categories of tools, and those would be medication, like pharmaceuticals, but also supplements, uh, and also food, right? Like if you improve your diet, if you're
Mhm.
not eating something that's very harmful to you, then that can massively improve. And then you have exercise, which can be physical exercise, but it can also be mental exercise. It can be, practicing mindfulness, that type of thing.
Yeah.
And then you have therapy, which is like, coaching, talking to people. And he would say, you have these three categories of things that can help you, and there's no right or wrong way to use those categories. So for some people, it might be, you know, 33% medication, 33% therapy and coaching, 33% exercise. For other people, it might be no medication, but lots of the other two. For other people, it might be more medication focused. And when I hear from friends who are struggling with mental health issues, like they're feeling depressed or they're experiencing anxiety for the first time or more so than normal, they'll say things like, my doctor hasn't found the right medication to fix this yet.
Right.
And my reaction is always, well, what if there is no medication that's just going to solve this for you on its own,
Right.
right? Like what are you going to do in addition to that? And I don't think that it's a coincidence that there's so many people that have this mindset of, I'm waiting for my doctor to find the right answer. I think it's because when we think about how our medical system works, there's so much focus on, you have to see the doctor has to make a diagnosis, and then you have to follow the doctor's treatment. And there's no acknowledgement of all the things outside of that appointment that the
Right.
doctor doesn't see that have such a massive impact.
Right.
And there's no acknowledgement of, kind of like you said, your own personal responsibility. That's such a huge thing. And even just believing that you have the ability,
Yes.
right? Like if you think that it's 100% on the pill or whatever medication the doctor is going to give you, then of course you're not going to be able to make a positive difference. But if you understand that you can, um, then that can be very powerful. And that's one of the reasons why I've been so thrilled to be working with you on this, is because you are a very experienced doctor, and so you have that history. And so you're not just, someone who's not a medical doctor saying, well, oh, well, I have a better answer, or, well, this is better than that, or, use this instead. You've seen it all. You've kind of have the medical perspective, and then you've embraced the more holistic side. And you're not saying that one is necessarily better than the other. You're looking for the complements, right? You're looking for the way that it all kind of comes together. And so I think that your unique perspective and experience is something that can really help a lot of people.
Yeah, I appreciate that. I think a couple things to emphasize on what you said, because this is very much a non-judgmental thing, right? In other words, if you go and you're depressed or you have headaches, let's use headaches because again, that one's sort of a classic one. If you go in and you're found to have migraine headaches, you may be, say a 40-year-old woman with two kids at home and trying to work and trying to keep the house and such, and you have these migraine headaches. You go to see the doctor and you're likely to end up with a prescription to prevent migraines, another prescription to treat the migraine if you get a migraine while you're on the preventive one. He might think you're depressed or whatever, and so maybe stuck on an antidepressant. Maybe you're not sleeping well. Give you something to help you sleep, and maybe you have some anxiety and something to help you as a sedative as well. So again, you might end up with 3 to 5 medicines, and again, if that's your choice and that works for you, I'm not saying that there's anything wrong with the pharmaceuticals. If it works, that's great. But for most people, that doesn't work. But this, again, in addition to those pharmaceuticals, right, you can, as you said, start to look at, hey, we all know that, I don't like to use the word stress. I like to think things more from an emotional sort of basis or behavioral. And so if you look at this from, hey, we all know that headaches, tend to get worse under emotional sort of issues, right? Stress, when you're under stress. And none of those pills, they don't do anything to treat that foundational issue, right? So in addition to those pills, you might start to look at, hey, what is it about my mindset, that might be contributing to these headaches? What is it about my lifestyle, that might be doing this? And, you might think there's nothing that I can do, right? I'm stressed. I have these 2 kids who are, having whatever issues. I'm stressed at work and my boss sucks, and all these kind of negative sort of, that's what I call a victim mindset. It is, and it's again, how are you looking at those situations? And then part of what we do at Gratefully Well is try to then take that mindset and say that victim mindset and turn it into what I like to call the victor mindset or the non-victim mindset, which is, okay, yeah, maybe you have a difficult boss, right? And it's stressful at work. That I'm not denying that. But that mindset where you go to work every day going, I hate my boss, I hate going to work, that's not helping you, and that's contributing to your headaches likely, right? Can you turn that around and find something and we use gratitude as one of the tools in Gratefully Well. That's one of the sort of the one of the mainstays, main tools that we use, that can you find something to be grateful for in that situation? And we work with that, and that can work, pretty well.
Mm-hmm. And another thing that just occurred to me is, I have a friend who, not so recently, I think it was a couple of years ago, he was having a number of mental health symptoms, and he was seeing a doctor about it. And the doctor basically said, well, these symptoms could be persistent depression, or they could be ADHD. So why don't we pick one of those 2 kind of at random and try you on medication for that for 6 months? And then if that doesn't help, we'll try you on medication for the other one. And he was kind of like, so I guess all I can do is take this medication for the next 6 months. And I was like, well, what if there's some things that you could adjust about your lifestyle that would help regardless of which diagnosis is correct? Or maybe they're both correct, and this would help both of those things. Right. And that's kind of like I think one of the many differences, and again, we're not saying that, medication isn't good. It's very good for lots of things. But if you have someone who's depressed, how many different antidepressants are there, right? And the doctor has to try them on different ones until they find the right one. And then if they find the right one, maybe they develop resistance to that after a while. It stops working as well. They have to change. They have to increase the dosage. Whereas, to my knowledge, every time that physical exercise has been tested against antidepressants, it has performed at least as well, right, when it comes to treating depression. So if we could just encourage people to, in addition to, taking an antidepressant if necessary, start doing some exercise, get out for a walk once in a while, that's like going to help almost no matter what, right? Like no matter what the correct diagnosis is, no matter what the correct antidepressant is, a little bit of physical exercise probably going to be a good thing. Whereas you could spend a year or longer trying different medications and not making any progress. And it's like, well, what if you just went for a walk every day while you were doing that?
Right. And then you forgot about you can start to combine medicines. So that if you don't find the right one, you can combine antidepressants, there's not a lot of studies that look at the combination. So it's kind of off-label sort of thing. But regardless, but another important thing that you sort of mentioned there, like, exercise. One of the things that I found important, is just the words that we use when we're doing some of these things from a mindset perspective, right? So when in our society, sometimes you tell the word exercise, a lot of people just bristle. I don't have time to exercise or whatever. You talk about dieting or diet, people think about weight loss, right? That just correlates there, whatever. So very careful trying to use from a mindset perspective different words. So we talk about living an active lifestyle as opposed to exercise, right? So if you brought up walking as an example, right? If you're, people think of exercise, they think, oh, they got to get on a treadmill, they got to run on a treadmill and go run outside. And they say, I'm going to run every day or every other day or whatever, but they hate running. It's unlikely to happen, right? And after 2 or 3 days or whatever, right? But most people will tell you, they enjoy walking. And then maybe, again, you have this, but I don't have time. I have to make time for my kids. Might as well maybe that can be a family activity you can do where you go out walking, or maybe you get bikes and you go out and ride bikes as a family or what have you. So it's that trying to just think about ways, to live to get outside and to live a more active lifestyle. When we talk about, diet, we use the word nutrition as opposed to diet, and trying to just, eat food that's, think of it as fuel, right? As opposed to rewards or what have you. And think about my nutrition here as opposed to weight loss and dieting and things like that. And then the weight loss would generally, when you start doing those things, kind of follow as your mindset then improves, right? As you start to implement, these sort of things. So I think what we've sort of said here is the important thing is that people, the way you think about things, right, is key, right? And so we don't talk about that much in medicine. Doctors are terrible at it in general. Like the way they speak with patients, they're not very careful about the words that they choose. And people hang on those words, right? They're not even just the word, but how they said the word. And so these things, are very important, but it goes back to the importance of the mindset, what I like to call beliefs. And a belief is nothing more than a recurring thought. And so it comes down to the power of a thought, right? Mm-hmm. And this is something in our culture that we talk very little about, right? But a thought can create physiology or change physiology, right? So if you think about it, right, if you're sitting in a room alone trying to fall asleep at night, and you hear a noise downstairs and you think someone might, have broken in, right? What happens? Your heart starts racing, your palms get sweaty. If you measured your blood pressure, their blood pressure would go up, the heart rate goes up, things like, even, believe it or not, your sugar goes up and things like that. And all that because of a thought, that someone broke into your house, right? Then you go downstairs, you find out no one broke into your house. Now you relax, you lay back down, right? So, but the sensation, the physiology that was going on in your body after that thought was the same physiology that if someone had broken in, right? So it's not the break-in that you're reacting to, it's the thought of the break-in. Same, right? Same thing can happen with fear, any kind of fear or anxiety or things like that. And so we focus a lot on that, the power of a thought, which again, in our society, we tend not to focus on.
Mm-hmm. And like you were saying, the power of using a different word, sometimes just changing one word. Yeah. Like I had another friend the other day tell me that she was feeling depressed. She said, "I'm feeling depressed today." And I said, well, depression is a diagnosis, which, requires a certain number of symptoms over a certain amount of time. What if you just thought about your feeling as you're feeling sad? Right. And, that's what you're actually feeling. That's the emotion that you're feeling. Right. And when you say to yourself, "I'm depressed today," or "I'm feeling depressed today," it's like you're telling yourself that there's something, that you have a diagnosis that says there's something wrong with your brain chemistry. And if you believe that, then you're probably not going to feel better tomorrow. But if you say to yourself, "I feel sad today because, I didn't get a lot of sleep last night, and then something disappointing happened this morning, and it kind of, set me up in a bad way, and now I just kind of feel sad." Well, that's a much easier thing to address, right? It's like, well, maybe you'll sleep well tonight and you'll have a better morning tomorrow and you won't feel sad anymore. And so I think that kind of like self-diagnosing with medical terminology that may be inaccurate or maybe you don't understand. And even if you do receive a diagnosis, like clinging to that diagnosis and being like, "This is who I am now," And especially when it's something like depression or anxiety, those can be very transient, where you have it for a period of time and then you can recover from it. But if you get a diagnosis of depression and you say, well, I'm a depressed person now, that's who I am, as opposed to, I've been diagnosed with depression for now because of how I've been feeling for the past few months, but that's not who I am. It's a very different way of thinking about it. And I don't really know exactly where that comes from, but I have seen it from a lot of people, both like my friends and just random discussions on social media, where people will say, like, I have received this diagnosis, therefore that's who I am. And the only thing that can help me is my doctor finding the right drug. And it's just so often not necessarily, like, they're not necessarily wrong that they have that diagnosis or that a drug could help, but it's the idea that there's nothing else they could do and that there's nothing else that has an impact on it.
Yeah, I think a lot of that was, as I'll be honest with you, is kind of promoted by the pharmaceutical industry. So if you go back, many decades, 50, I don't know, when the term depression, was used very differently. And now it's become a condition. And so it's a condition that then you can develop, you can't develop a pharmaceutical for something if there's not a condition for it, right? So once the condition sort of was labeled as depression, then we could make medicines for it. And so, and back 30 plus years ago, when I sort of really was struggling and I had just gone into practice and I was really busy, and I became depressed, as the counselors would call it, therapists would call it. Depressed. I called it misery, miserable, right? They used to say, you need medicines. You have depression. You have a chemical imbalance in your brain that this medicine is going to fix. And I said, well, I feel miserable. I don't, you can call it depression, you can call it whatever you want. I said, but and I don't disagree. I went through pharmacology. I understand that the antidepressants maybe change brain chemistry and maybe they fix brain chemistry. I'm not going to deny that. But how did the chemical imbalance get in there to begin with, right? And again, there's very little discussion, at least between therapists and patients, about the power of thoughts. But again, thoughts create these changes in neurochemicals, right? These neurotransmitters and hormones and such that are in the body, that are in the brain. And there's very little focus on that. So again, I'm not against necessarily the antidepressant, right? But you need to do something in the meantime. I'll give you an example, like where we are. Again, this is back 30 years ago. There was a study being done. It became known that people who had bypass surgery tended to have more depression than people who didn't have bypass surgery. Okay. So this company who manufactures antidepressants basically wanted to do a study they wanted me to participate in, where you had patients, refer patients there, patients who had bypass surgery. Half of them would get a placebo and half of them would get this antidepressant, and they wanted to follow them for couple of years or something and see if the antidepressant made sense. And I was like, okay, well, what else? I said to the people who developed the study, I said, what else are you doing for these people? I said, what do you mean? And I said, well, you can't just take someone who's depressed and just put them on a medicine and that's it. Like, are they getting therapy in addition or whatever? They said, no, we're just doing the medicine. I said, I'm not interested in participating. They were like, why not? I said, well, again, I'm not against the medicine, but I think it's just very short-sighted to think that you can treat depression just with a medication and nothing else. And I think a lot of these illnesses or syndromes, like migraine headaches as an example, or irritable bowel, I think of them, maybe it's not mental illness, but there's an emotional component. I think if anyone with, as an example, migraine headaches, I think should see a therapist, right? Like, maybe they're going to need the medicine, that's fine, but they should be getting some kind of therapy in addition, because that's the foundational issue.
Yeah, it's like, I think the beauty of the holistic approach is that, like, you're not we're not saying that that, for example, depression isn't caused by an imbalance in brain chemistry, or that medication can't help with that.
Correct.
But what if there's some things that you're doing every day that are contributing to that negative brain chemistry that you could just stop doing?
Right.
Or what if there's some things that you could start doing that would improve that you're not doing?
Exactly.
And that's where you get into, like, if you're just taking the medication, well, that might work for a while, but then you develop a tolerance to it, or some medications you have to cycle off of, right? Because you can't take them forever for whatever reason. Or like you lose access to the medication somehow. Any number of things could happen where all of a sudden, that's not working the way it was. And then you just go back to having that same problem. And that's assuming that the medication is 100% effective on its own, which it almost never is, right? Like, especially with mood related things, it's not just a button that you can push. It's not just like an antibiotic where, you have an infection, we give you this medication, it kills the infection, and now you're okay. There's all these different things that are influencing it. And when you try and just kind of focus on this one external thing in the form of medication, or even if it's, therapy, like, I think therapy is great. I think in particular, it's really important to get the right type of therapy for the type of person that you are, the type of issue that you're dealing with. But if you're like, oh, I have anxiety, I'm just going to go to therapy for that. Well, if your therapist is just happy to talk to you once a week and collect your money, then you might not actually go anywhere with that. You might, you might need to take a more holistic approach to it.
Yeah, I think it comes to mind as a great example of, and because this is becoming increasingly popular, are what are called vagal nerve stimulators. And so in our society, we have a lot of stress, and a lot of the sympathetic nervous system, right? So we have this autonomic nervous system that exists within the body, and there's a sympathetic and a parasympathetic part of it. The sympathetic part is this part that is the fight or flight kind of response, right? When you're in a situation. The parasympathetic response is more the slowing down. It helps with digestion. It helps with relaxation, calming, and digestion. It tends our sympathetic nervous system tends to be always elevated. The parasympathetic system is always sort of decreased. The vagal nerve stimulates the parasympathetic nervous system, and so what people have found is that you can stimulate the vagus nerve. So there are these mechanical vagal nerve stimulators, and stimulate the vagus nerve, increase the parasympathetic nervous system, and you get improvement in a lot of potential things. So like they've used them from everything from heart failure to depression to a lot of autoimmune diseases they're being used for. So these are sort of being used as this now in a panacea kind of helping people. And these instruments, these devices, are like $50,000 to $75,000, devices by the time you get them implanted and stuff. And all they do, and everyone will tell you, the manufacturers will say, well, how does this work? Oh, it stimulates the parasympathetic nervous system. Well, there are a lot of other ways to stimulate the parasympathetic nervous system that you can do yourself, like meditation, like mindfulness, like humming, like chanting.
Breathing differently, deep breathing.
Breathing can stimulate it, right? There's all sort of there's therapy you can actually do that for it as well. But it's something that you have to do, and this goes back to that willingness to participate in your own healthcare. To get the stimulator put in. Right? If your insurance company pays for it and such, you don't have to pay for it. They put it in, it stimulates your vagus nerve. You don't have to change anything. Maybe it's effective in that sort of way, but if you would be willing to participate in your own healthcare, and you can stimulate, your parasympathetic nervous system or vagus nerve, then you can get the same kind of improvement. But no one's going to do that study. No one's, they do the study of the stimulator versus not the stimulator. Oh, the stimulator helps people feel better. But no one's going to do the study of, hey, let's compare the stimulator to humming.
Mhm.
as an example, right? So it's just where we are.
Yeah. I the first time I was introduced to the parasympathetic and sympathetic nervous system was I saw a naturopathic doctor for severe chronic insomnia, which I had from about age 10 to 26.
Mm.
So for all of my teenage years and my younger adult life, I had very, very severe chronic insomnia. I'd seen a number of doctors, counselors, tried a bunch of different medications, and eventually I saw this naturopathic doctor,
Mhm.
and she said, "Okay, well, I'm going to teach you something called diaphragmatic breathing."
Yeah.
And I said, "Oh, I already know how to do that. I'm a singer. I
Uh,
learned how to do that as a singer." And she said, "Oh, well, do you breathe like that all the time, except for when you're exercising?" And I said, "Well, no." And she said, "Okay, well, I'm going to teach you how to breathe like this as your default way of breathing, because
right.
that's going to keep you calm. And when you're calm most of the day, you're not going to feel as stressed when you go to bed at night, and you might sleep better." And that in and of itself didn't solve my insomnia issue, but it did teach me how to relax, like intentionally, right? It's just like, if you notice that you are feeling anxious, you're probably breathing shallowly. And so, what if you just focus on exhaling all of the oxygen in your lungs, holding that for a beat, and then inhaling right down to the bottom of your diaphragm, holding that, and exhaling a little bit? And it's just like, it's the simplest thing. And I think, and we've been talking a lot about how it's the personal responsibility to be willing to act on your own and do things in your own life that will make a difference. But it's also learning how to create those habits, right? Because it's not easy to build something into your life like that. And it can often be easy at first to be like, "Oh, I've got this, someone told me about this exercise, I'm going to do it." You do it once, it helps. But then if you don't somehow figure out a way to do it every day, or at least often enough, then it's not going to be helpful, right? It'll be like, "Oh, well, yeah, that kind of helped a little bit at first, but then I stopped doing it and it didn't help anymore." And it's like, "Oh yeah, well, if you were taking an antidepressant for a couple days, and then you just stopped taking it and it didn't help, like, is that because it was the wrong antidepressant, or is it because you didn't take it?" Um,
Right.
yeah, I think that, and there's a lot of resources about building positive habits and stuff available these days as well. And so I think like that, like being able to kind of to build a habit in a way that's going to keep it, and then if you have some sort of a help with that, like whether it's that can be part of, like, if you're seeing a therapist, instead of just always talking about the problem or whatever, it could be like, so hey, did you do your exercises this week? Like, how are you doing with your breathing? How are you doing with your, like, did you try humming the last time that you were feeling this way? Like, how did that go? um, and then that way you don't have to have the entire responsibility on yourself all the time. It's not just, you're not just trying to remind yourself every day and trying to force yourself to do it. You can kind of build a habit, and maybe have a little bit of help with reminders from someone else.
Yeah, I think it's a good example, right? And what the therapist actually should have said is, "I'm going to help you remember how to diaphragmatic breathe instead of teach you," because this is something we were born knowing, right? Like if
Yes.
you watch an infant, they breathe through their diaphragm, right? They lay there. If you watch their belly is going up and down. In our society, we teach that that's not a good thing. It doesn't look good, or we under stress. We tend to contract our abdominal muscles. So we forget. It's not that we have to learn it. We forget how to do it. It's a natural way to do it. But the other important thing, I think, is that some of the things that we try to do, in some of these practices are things that you can do, what I like to call it, on the fly, right? So you could be in the line at the grocery store. It's always the slowest line, right? You're in, and maybe you've got to get somewhere, and you're frustrated. As you're sitting there, you notice you have, well, I like to think of it as, you don't even have to label the emotion. You don't have to, is it irritation? Is it frustration? Is it anger? Is it rage? You don't even have to do that. You just say, I have a negative emotion. The degree of the negative emotion doesn't really matter. I'm having a negative emotion. And what's happening there is you're actually choosing this victim mindset that we talked a little bit about at the beginning. So as soon as you realize that, you have a choice. This is the other thing that we teach a lot is, is perception is all about a choice. So I'm perceiving this line is moving slow, and the universe or this cashier or whoever is doing this to me. And you can fight against it. And when you do that, all of these negative things are happening in your body, right? Your blood pressure is going up, your heart rate's going up, your muscles are tense. Good things are not happening. And people are saying, well, it's the line that's doing this to me. It's the, this slow line. It's this person who, can't get their credit card to work or in the thing, whatever it is. But it's not the person, it's not the line, it's your choice, right? You're doing it to yourself. And so you could just as easily, not easily, you could also choose what I like to call, again, that non-victim mindset or victor mindset, where you say, you think of something, and I use gratitude because that's sort of the easiest thing, right? Or a benefit of the doubt, right? Maybe it's a 80-year-old woman and she's struggling with getting her credit card to work, as an example, right? And you might go try to help her. You give her the benefit of the doubt, saying, she's doing the best that she can, right? Or you find something to be grateful for. Hey, I'm frustrated because this line is going slow, but fortunately, I don't have to be somewhere like in the next 5 minutes. And just that change in mindset, which you can do in the line, and you can do diaphragmatic breathing as you're standing there, right? And so you do your diaphragmatic breathing, you do a gratitude exercise or a benefit of the doubt exercise, and your whole physiology changes, right? Mm-hmm. But again, you have to be willing to take that responsibility of your healthcare to do that, because it's much easier to play the victim, right? It's much easier and then you can go tell people, you know what happened to me? I was in a hurry. I always get in the slowest line. This lady couldn't get her money out. She couldn't get her credit card to work. The cashier was new. She made a mistake. They had to go find a manager to come fit, and you can tell these stories. And we tend, to choose that response. So you have to be willing to take that responsibility, which it looks like that's become a theme of this episode. But it's an important part, because I think if you're not willing to do that, then go and be angry, all the time.
Yeah, I think you just kind of nailed the core of mindset and why it's so important. And it's because your mindset affects how you do everything, right? Like if you have like you were saying, a victim mindset, then any little inconvenience is going to be something that you find upsetting. Right. And it's going to cause negative emotions, negative thoughts, which can potentially cascade into something even worse. Or, then it's just a matter of having enough little things in a day that aggravate you. And anytime that a few things like that happen, you're going to have a terrible day, right? You're going to feel bad because it's going to build up. Whereas if you have more of a gratitude-based mindset or a anti-fragile mindset, when you're stuck in that line, instead of thinking, oh, I hate being stuck in this line, you can think, yeah, I'm going to take this opportunity, since I'm just standing here, to make sure that I'm doing my diaphragmatic breathing. Maybe I will hum a song. Oh, I'm standing here with nothing else to do. Maybe I'll just pull out my phone and text that old friend who I've been meaning to stay in touch with, and we haven't talked. And all of a sudden, it's like this thing that could have been something that's upsetting you becomes an opportunity to improve your life, because you just spent 5 minutes like refreshing your mind, refreshing your body, refreshing a relationship with an old friend. And then you get out of the line and you're grateful that you got stuck in that line instead of being upset about it.
Yeah. I mean, again, great example, right? But again, it goes back to, it's easier to pick that victim mindset, right? We just kind of fall into it. And this was a big thing for me. I mean, I used to call myself the super victim, right? I could create a victim scenario even when there wasn't any scenario to be victimized about. And so it's a trap, right? That victim mindset is a trap, because it has negative consequences, a lot of negative consequences. That victim, I like to think of it as a path. If you pick that victim path, right, it's lined with negative emotions. It's lined with frustration and irritability and annoyance, and it always ends in misery, right? That non-victim or victor path always ends in what I like to call peace or joy, right? It's lined with positive emotion.
Yeah, and it's, I mean, it's certainly not easy, especially at first, but it is a practice. right? The more that you
Yes.
the more that you get used to responding, yeah, it's a habit. It's your mindset, right? It's your default way of engaging with the world
Yeah.
and reacting to it. And so if you're used to having a victim mindset, even if it's not all the time, if it's just related to certain things, then yeah, it'll be difficult at first to kind of reverse that and go against it. But the more you do that, the less resistance you'll face. And eventually you get to a point where that is just kind of your default way of approaching things, where, when something bad happens, you don't, start thinking about all of your negative emotions or thinking about what other bad things that might lead to in the future. You're not going to kind of like catastrophize. You're going to say, okay, well, what's the solution? What can I do to fix this? Or if I can't fix this, what opportunity is this presenting that wasn't there before? What's the silver lining? And once you build that kind of like positive mindset reflex, then it's not so difficult anymore, and it just kind of becomes like just sort of a part of who you are. And that doesn't mean that it's always going to work like that, or that you don't have to still work on it. Like when I know this happened to a lot of people, but it also happened to me during the lockdowns that we had 4 or 5 years ago. Is when I gained a ton of weight. I got really unhealthy. I was previous to that, I was eating healthy. I was pretty fit. I was exercising, had an active social life. And then during the lockdowns, all of that went away. And I was stuck in that, and I was completely incapable of improving my diet or my fitness or anything, as long as I was thinking to myself, this was done to me by the lockdowns, right?
Right.
It wouldn't have happened if not for the lockdowns. And
Right.
that's technically accurate. It wouldn't have happened without the lockdowns. But I could have kept eating healthy, and I chose not to every day. I could have kept exercising. I chose not to every day. I could have found ways to keep an active social life, but I chose not to repeatedly. And that led to me gaining a bunch of weight and becoming more depressed and more anxious. And it wasn't until I started saying, okay, well, it doesn't, like, it happened. It doesn't matter whether this was done to me, or it doesn't matter to what percentage it was my fault or not my fault. It just matters that this is where I am now. And if I don't want to be in this place anymore, then I need to start taking responsibility and moving away from it. And I did get help, like I got some help from my doctor. He gave me some medication that helped. I saw a nutritionist for a while. She didn't even really teach me anything about nutrition. It was just like having someone to talk to about cooking and back into that kind of healthy eating. And so I didn't do it alone, but none of it would have happened if I hadn't taken that mindset and been like, you know what, I'm not satisfied with just telling myself that it's not my fault. I don't care whose fault it is. I want it to get better, and I'm going to do what I can to improve upon that.
Yeah, and that's the trap. Whenever you find yourself saying, or wanting to say, but it's not my fault, that's the trap, right? Because as you sort of described, it's not really about whose fault it is. Ultimately, the reality is it's going on, right? This is happening, and whether the lockdown is happening, right? The choices that you made happened, and so now you have a choice, and that. But that's the thing that helped me, is this idea that perception is a choice, right? Because if I can choose now, I may choose that victim mindset, even if I do that today, which I do it I'm much less likely to do that today than I used to be. But even if I choose that, I know that I chose it, and when the fact that it was in my control and that I chose it. It changes again that physiology, and then the next thing I know, I find that I'm on that non-victim mindset somehow, or path, right? And so, but it's that choice, and it's much. All I can say is it's much easier to be the victim or to say it's not my fault, and but it's a trap.
Yeah, and just because you're going to work towards and intentionally cultivate a victor mindset or like an anti-fragile mindset, that doesn't mean that you're never going to have a moment where you feel like a victim. But the difference is that instead of being like, oh, I'm a victim, and then just making the rest of your day or your week about telling all these stories about what a victim you are, the difference is you have that feeling and you let that happen, and then you move on from it and you go, wow, wasn't it silly that I was just feeling like a total victim just because something bad happened that, maybe it was outside of my control, maybe it was partially in my control. But like you're saying, it doesn't actually matter whose fault it is. It's your life, so it's your responsibility, right? No one else can really take responsibility for you the way that you can. And so I think that's like the key to understanding that.
It goes back to what I like to call self-awareness and then self-acceptance, right? Or other people call it self-compassion. I like self-acceptance better than that self-compassion term, but the same thing. But it is, the thing I like about this is, again, there was a time when I first started doing this is about 20 plus years ago, where I learned the technique, right? The gratitude or benefit of the doubt. And then I would continue to sort of choose that victim mindset. And I would beat myself up even more, very judgmental sort of way. And today it's more like, I chose that. That's fine. I can always choose again. It's not, you're not stuck there, right? And then not judging the fact that, hey, why did I pick the victim mindset? Why do I keep doing this? It's not like that. It's that awareness, that negative emotion gives you that awareness, right? And then if you choose to stay in that victim mindset, it's that acceptance or that self-compassion. Say, hey, for whatever reason, I chose to do it. I wanted to stay there, but you know what? I'm ready to get out of that. I'm willing to, and now you have a tool that you can use to get onto that victim mindset.
Yeah, that kind of reminds me of like sort of this like one of my favorite I guess schools of philosophy, but also mindset is Stoicism. And I hear a lot of like negative talk about Stoicism these days, where people are saying that like being Stoic means not having emotion, or being Stoic means hiding your emotions or cutting yourself off. And that's not what it is at all. In fact, if you look at modern teaching of mindfulness, it's basically just Stoicism with some of the terminology changed. Right. And what a Stoic mindset really is like just deciding that my emotions and feelings are not going to dictate how I behave. And so it's like the same type of thing. It's like, I can feel sad, I can feel angry, but the difference is that I'm not going to tell myself that I'm depressed because I felt sad. I'm not going to try to punish myself because I felt angry and be like, oh, now I'm this angry person. I can't. No, I'm going to feel the thing. I'm going to accept that, and I'm going to move on from it when I'm ready. And like you say, not judge myself for having a normal human emotion, right? And in the same way, it's normal to feel sad or angry sometimes. It's normal to feel victimized sometimes, and sometimes it might be accurate. Like I said, with the lockdowns, a lot of people got unhealthy in ways that they wouldn't have if that hadn't happened. But ultimately, as individuals, we still have the power to make a different choice going forward and to move on from that. And it's not worth it's not worth beating yourself up because in the past you weren't doing what you now want to do.
Yeah, I think that's important is recognizing that inner critic, right? Or that judge, as I like to call it, right? And that recognition, then what follows has to be the self-acceptance or self-compassion. It doesn't have to be, but you can listen to that judge or that inner critic. But if you really sit down and inquire about what that judge or that inner critic is saying, you'll find that there's not any truth to it. But you have to take the time to sort of do that inquiry. And there's many different methods to do that, right? Is this really true? What this inner critic is saying. But ultimately, you have to get to, like you said, that self-compassion or self-acceptance.
Or even if it is true, like say I like go to a job interview and I don't do a very good job in the interview and I don't get the job as a result of that. I could be the inner critic could be saying, hey, you didn't do a very good job at that job interview. And so that could be objectively true. But if I look at that and say, well, I'll never be good at interviewing, and it's just going to be that way all the time. If I try again, I might as well not even try. That's the victim response to a true observation. The positive response to that observation would be, well, hey, it was practice, right? I'm going to get another interview. I'm going to try again. I'm going to think about the things that I didn't do well, and I'm going to see how I can work on improving them. And so it all comes back to that same, the mindset of like, I can do something about this versus there's nothing I can do about this. This is just happening to me. And I'm just kind of along for the ride.
It goes back to that idea of thoughts, right? So thoughts can run away with you, right? And so that phenomenon, called catastrophizing, right? So when you have a bad job interview, all of a sudden it's like, I'm terrible at interviews. I'm never going to be good at interviews. I will always be horrible. I'm never going to get a job. I'm a terrible person. I'm, whatever, right? So that's making it pervasive, like in fact, in affecting all parts of your life. And when you stop to do your inquiry, you go, wait a minute, is this true? Well, it's true that you maybe screwed up that interview, but as you said, hey, but I got some practice out of it, right? But does that necessarily mean that I'm a terrible person? Does it mean I'm never going to get a job? Does it mean that I'm never going to be good at interviewing, right?
Yeah.
It doesn't mean necessarily any of that. So that's the part that you can take the true part and you can then what's the word, elaborate it, right, to parts that really don't make any sense. But you have to stop to do that inquiry, and most people don't do that. That's the other willingness part, right?
Yeah, I think it's acceptance without judgment, or acceptance without extrapolation. It's just kind of like, okay, that this bad thing happened. Right. It's true that it happened, right, but that doesn't mean all these other negative things that could come along with that. It's just one isolated thing, and how I respond to that is up to me. It's not like I had a bad interview. That doesn't mean all the rest are going to be bad. That's up to me, and if I choose to approach it differently, if I choose to learn from those things, then it's probably going to get better. And then you can kind of have this upward spiral of positive thinking instead of this downward cascade of like, all these things that didn't really happen, or things that could happen that you're going to stress out about. And it's almost like seductive or addictive in a way, where it's like, you start having these negative thoughts and you can just let it consume you. Yes. And then it's like, oh, well, I'm helpless now, like, oh, my brain ran away with me. And again, there's nothing wrong with feeling that way sometimes, but it's just a matter of like, if you really want the positive change, then you're going to have to take that responsibility at some point and just move forward from that.
Yeah. And so what people will say is you have to monitor your thoughts. I always say, it's hard to monitor your thoughts. That's why I think it's easier to monitor the emotions, and you don't have to, again, label the emotion. We just talk about, is it a positive emotion or is it negative? Most of these are going to be obviously negative emotions. And so that's my signal, right, that I use to say I've chose the victim mindset because I'm having this negative emotion 100% of the time means I chose this victim mindset. So this is the thing that we talk a lot at Gratefully Well. We talk about it on the Gratefully Well newsletter, which is on Substack.com. So I started that about, I don't know, maybe it's been 3 months or so ago. I'm not sure. But so a lot of the issues there start to talk about, all of these concepts, and these mindset concepts are out there. It's the same concepts that are used in, peak performance. Athletes use them, right? Military people use them. CEOs and leadership people use the same concepts. We try to relate it to health, obviously, I'm a physician, but it relates a lot to, especially to chronic disease. Whether you have something that's medically unexplained or you actually have a chronic disease like autoimmune disease or something like that, these principles all sort of play a role as well. And that's what we try to talk about or think about or present.
Yeah, I think that's a good place to start wrapping it up. So as you mentioned, you're on Substack. So people can find you there by searching Julius Torelli or by searching Gratefully Well. It's juliustorelli.substack.com. There's also the Gratefully Well website at www.gratefullywell.com. You can go there to join the free 7-day gratitude challenge, which is a great introduction to gratitude as an element of mindset, and includes 7 days of exercises and examples that you can use to really start cultivating a more resilient and more positive mindset. So that is where you can find Dr. Julius Torelli and Gratefully Well. He's also on Instagram and Facebook. if you want to look him up there and engage. And so before we send this off, is there anything else you want to say, Julius?
No, I think we'll talk more about the gratitude. It's called Gratefully Well, and we use gratitude as really sort of the foundational part of this. It's a tool, right? It really, I think the model really goes back to the idea of this mindset and this willingness to participate in your own healthcare.
Mm-hmm. I think the gratitude is a great place to start, because if you can't kind of find the good in daily life, if you can't find something to be grateful for in, just in every day of your life, then you may have difficulty cultivating other aspects of a healthy mindset. Right. I think it's a really good starting point, and it's just such a powerful example of everything that we've talked about, like about how thoughts and feelings and awareness and intention can just affect your mood and your mental state as a whole. And it's really quite mind-blowing. If you've never practiced gratitude before intentionally, when you start doing that intentional, authentic gratitude practice and, doing some of the exercises that are included in the challenge, you'll have these positive feelings, these just feeling better, feeling more optimistic, feeling like you're moving forward or reaching forward for something. And it's literally just from thinking a certain way, or possibly writing something down. But it's like it's just the simplest thing that you would think that you might need a pill for that, but no, you can do it on your own with just this simple exercise.
Yeah, I think that's one of the things. Again, you can. We talk a lot about the different methods of practicing gratitude, right? And so, and we can get into the details here, but you can certainly do gratitude journaling, which is wonderful. But gratitude journaling, you have to sit down, you have to have time, you have to have a journal, whatever. There are ways to do this. I have to think of on the fly, and some methods that I think are more effective than just even gratitude journaling. And so we can talk more about that as well.
Yeah, I think that the gratitude journaling is great because it's like a kind of a beginner entry level way to get into it, where it's once you put the thoughts down and you have to write them out, you really have to get into that. So if you've never done it before, that's a good way to start. But yeah, with any kind of mindset thing, the idea is to get it to the point where it's just how you are. You
Right.
wake up in the morning and you're thinking about how grateful you are. It's like, oh, I didn't get a great sleep last night, but hey, I slept 4 hours. That's better than 3, right? That's better than 2. That's better than nothing.
Yeah.
Or, at least I did have some dreams. That means I got a little bit of REM sleep. There's all these things that you can be grateful for. And then all the standard things too. It's like, I just woke up and hey, I still have my family. I still have my house. I still have my pet. And again, you create that like positive upward spiral of feelings instead of the opposite, or instead of just being stagnant. Anyways, I feel like I could talk to you about this stuff forever, but we should probably sign it off here.
I think that's great. I appreciate it.
All right. So thanks for talking to me, and maybe we'll be back soon with another episode.
Sounds good.